In this video, we'll explore the top 7 breakthroughs in treatment and how they can help you on your journey to recovery. From surgery to immunotherapy, the world of kidney cancer treatment can be overwhelming and complex. If you're feeling overwhelmed by a recent diagnosis of kidney cancer, you're not alone. As with any cancer diagnosis, early detection and treatment are key to beating kidney cancer. Number 7. Clinical trials. Clinical trials are research studies that evaluate new drugs and medical procedures for their safety and effectiveness. Patients with kidney cancer may be offered the opportunity to participate in clinical trials to receive innovative treatments that may not be widely available or approved for standard use. There are 4 different types of clinical trials, including phase 1, 2, 3, and 4 trials. Phase 1 trials involve the testing of a new drug or therapy for the first time in humans to determine its safety and appropriate dosage levels. Phase 2 trials are designed to evaluate the effectiveness of the treatment in a larger group of patients with kidney cancer. Phase 3 trials compare the new treatment to standard treatments or a placebo to determine if it's more effective. Phase 4 trials are conducted after a drug or therapy has been approved and are used to monitor the long-term effects of the treatment. Some clinical trials for kidney cancer focus on immunotherapy, targeted therapy, and combination therapies that aim to improve patient outcomes and survival rates. Patients may also participate in clinical trials that investigate the role of genetic testing, biomarkers, and imaging techniques in diagnosing and treating kidney cancer. Participating in clinical trials for kidney cancer may offer patients access to innovative treatments and medical care. Patients should discuss their options with their healthcare provider and carefully weigh the potential benefits and risks before deciding to participate in a clinical trial. Number 6. Chemotherapy. Chemotherapy is not considered a first-line treatment for kidney cancer. This is because kidney cancer cells are not very responsive to chemotherapy drugs, meaning that chemotherapy is generally not very effective in killing these cells. However, in some cases, chemotherapy may be used to treat advanced or metastatic kidney cancer, which has spread to other parts of the body. The chemotherapy drugs used to treat kidney cancer may be given either orally or intravenously. They work by targeting and killing rapidly dividing cells, which includes cancer cells as well as some healthy cells in the body. This can cause side effects such as nausea, vomiting, hair loss, and an increased risk of infection. Chemotherapy is often used in combination with other treatments for kidney cancer, such as surgery or radiation therapy. The specific combination of treatments used will depend on the stage and location of the cancer, as well as the overall health of the patient. It's worth noting that there are many different types of chemotherapy drugs, and they can be used to treat different types of cancer in different ways. Your doctor will be able to provide you more specific information about the use of chemotherapy used to treat kidney cancer and what you can expect from this type of treatment. Number 5. Radiation therapy. Radiation therapy is a treatment option for kidney cancer that uses high-level radiation to kill cancer cells. The radiation can be delivered internally or externally, depending on the location and stage of the cancer. External radiation therapy is the most common use of radiation therapy for kidney cancer. It involves a machine called a linear accelerator that directs high-energy radiation beams at the cancerous cells from outside the body. The treatment is usually administered daily over several weeks. Internal radiation therapy, also known as brachytherapy, involves placing small radioactive pellets or seeds inside the body near the cancerous cells. The radiation is delivered directly to the cancerous tissue and can be a more targeted approach than external radiation therapy. This type of radiation therapy is less commonly used for kidney cancer. Radiation therapy can be used in combinations with other treatments, such as surgery or chemotherapy, to help improve outcomes. It can be used palliatively to help relieve symptoms in advanced cases of kidney cancer. As with any treatment, radiation therapy can have side effects. The most common side effects include fatigue, skin irritation, and nausea. These side effects are usually temporary and can be managed with medications or other supportive therapies. More serious side effects, such as damage to nearby organs, are rare but can occur. Your healthcare team will work with you to manage any side effects and ensure that you receive the best possible care. Number 4. Ablation Therapy. Ablation therapy is a minimally invasive treatment that uses heat or cold to destroy cancer cells. It's often used for small tumors that are less than 3 to 4 centimeters in size, or for patients that are not good candidates for surgery. There are 2 types of ablation therapy: radiofrequency ablation, RFA, and cryoablation. In RFA, a needle electrode is inserted into the tumor, and an electric current is passed through the electrode to heat and destroy the cancer cells. In cryoablation, a probe is inserted into the tumor, and liquid nitrogen and argon gas is used to freeze and destroy the cancer cells. Ablation therapy is typically performed under local anesthesia and mild sedation and does not require a hospital stay. The procedure can take 30 minutes to 2 hours, depending on the size and location of the tumor. Ablation therapy is generally safe and effective, with a low risk of complications such as bleeding, infection, or damage to nearby organs. However, it may not be suitable for all patients or all types of kidney cancer. After the procedure, patients may experience mild pain or discomfort, which can be managed with over-the-counter pain medications. Follow-up imaging is usually done to ensure that the tumor has been completely destroyed and to monitor for any signs of recurrence. Overall, ablation therapy is a promising treatment option for kidney cancer that offers a less invasive alternative to surgery with fewer risks and a faster recovery time. However, the best treatment option for each patient will depend on factors such as the size and location of the tumor, the patient's overall health, and their personal preferences. It's important for patients to discuss their treatment option with their healthcare provider to determine the best course of action for their individual case. Number 3. Immunotherapy. Immunotherapy is a type of cancer treatment that harnesses the body's immune system to fight cancer cells. The immune system is the body's natural defense mechanism against foreign invaders, such as viruses and bacteria, but cancer cells can sometimes evade detection by the immune system. Immunotherapy works by activating or enhancing the immune system's ability to recognize and attack cancer cells. There are several types of immunotherapy used to treat kidney cancer, including checkpoint inhibitors, cytokines, and adoptive cell transfer. Checkpoint inhibitors are drugs that block specific proteins on the surface of immune cells, allowing them to recognize and attack cancer cells. Cytokines are naturally occurring proteins that stimulate the immune system to attack cancer cells. Adoptive cell transfer involves removing immune cells from the patient, modifying them in a laboratory to target cancer cells, then infusing them back into the patient. Immunotherapy can be given as a standalone treatment or in combination with other treatments, such as chemotherapy or targeted therapy. It is typically administered through intravenous infusion or subcutaneous injection. Immunotherapy has shown promising results in the treatment of kidney cancer, particularly in patients with advanced or metastatic disease. However, like all other cancer treatments, it can have side effects, which may include fatigue, nausea, diarrhea, skin rash, and fever. The severity of side effects varies depending on the type of immunotherapy and the individual patient. It's important to discuss the potential risks and benefits of immunotherapy with a healthcare provider. Number 2. Targeted therapy. Targeted therapy is a type of cancer treatment that uses drugs to target specific proteins, enzymes, or other molecules that are involved in the growth and spread of cancer cells. Unlike chemotherapy, which kills both healthy and cancerous cells, targeted therapy is designed to target cancer cells more specifically and cause less damage to healthy cells. In the case of kidney cancer, targeted therapy drugs are used to block specific proteins or pathways that are involved in the growth and spread of cancer cells. For example, some targeted therapy drugs may target proteins called tyrosine kinases, which are involved in signaling pathways that promote the growth and survival of cancer cells. By blocking these proteins, targeted therapy can slow or stop the growth of cancer cells. Some of the targeted therapy drugs that are used to treat kidney cancer include sunitinib. This drug targets the vascular endothelial growth factor receptor, VEGFR, and is used to treat advanced kidney cancer. Pazopanib. This drug also targets the VEGFR pathway and is used to treat advanced kidney cancer. Cabozantinib. This drug targets multiple tyrosine kinases, including VEGFR, and is used to treat advanced kidney cancer. Bevacizumab. This drug targets VEGF and is sometimes used in combination with other drugs to treat advanced kidney cancer. Targeted therapy drugs are usually taken orally, either in pill or a capsule form, and are taken on a regular schedule. The duration of the treatment depends on the stage and type of kidney cancer, as well as the individual's response to the treatment. While targeted therapy may be effective in treating kidney cancer, it can also cause side effects, including fatigue, nausea, diarrhea, high blood pressure, and skin problems. It's important for patients to discuss the potential benefits and risks of targeted therapy with their healthcare provider before starting this treatment. Number 1. Surgery. Surgery is often a primary treatment option for kidney cancer, particularly for localized tumors that have not spread beyond the kidney. The goal of the surgery is to remove the entire tumor, along with some surrounding tissue. The most common surgical approach for kidney cancer is radical nephrectomy, which involves removing the entire affected kidney, nearby lymph nodes, and sometimes the adrenal gland. In some cases, a partial nephrectomy may be performed, which involves only removing the tumor and a small margin of surrounding healthy tissue, while preserving the rest of the kidney. Minimally invasive techniques, such as a laparoscopic or robotic-assisted surgery, may also be used to remove the tumor. These approaches involve making several small incisions instead of one large incision and using a camera and specialized instruments to perform the surgery. Minimally invasive surgery generally leads to less pain and a faster recovery time compared to traditional open surgery. After surgery, the removed tissue will be examined under a microscope to confirm that all of the cancerous cells have been removed. Depending on the stage and grade of the cancer, additional treatment such as chemotherapy or radiation therapy may be recommended to help reduce the risk of recurrence. Overall, surgery can be a highly effective treatment option for kidney cancer, particularly when the cancer is caught early and has not spread beyond the kidney. It's important to discuss the risks and benefits of surgery with a healthcare provider to determine the best treatment approach for individual cases. Kidney cancer treatments have increased significantly over the years, offering patients more options with better outcomes. With a range of treatment options such as surgery, radiation therapy, chemotherapy, immunotherapy, targeted therapy, and clinical trials, doctors can create personal treatment plans based on a patient's specific needs. With early detection and appropriate treatment, many kidney cancer patients are living longer, healthier lives. While dealing with cancer may be challenging, it's reassuring to know that there are many effective treatment options available for kidney cancer. If you guys got value out of this video, give it a thumbs up, leave a comment down below, consider subscribing to the channel as I'll be uploading more kidney related content videos weekly. Thanks for your time, and I hope to see all of you again in the next video. Take care.